has requested a temporary excuse. You do not have a quorum present.
Thank you. So the way we can proceed with this is, Commission Counsel, you were quoting out of the charter from me when we were just discussing. So if we don't wind up with a quorum, what can we do?
So through the chair, without a quorum, you cannot take any votes. However, you can discuss the items and go through them. And if there's no quorum at the end, then we can simply move these forward without recommendation of full board for vote and consideration at that time.
Okay. And that kind of fits nicely with how the chair of this committee does stuff. She takes one big motion at the end. We don't vote on items as we go under her stewardship. So that's what we're going to do. We're going to proceed on. If we wind up with a quorum, we'll take votes. If we don't, it'll be reported to full board, everything on the agenda today, and the vote will take place there. All right, Madam Clerk, what do we have next?
Moving to item 1 under new business, requesting commission approval of a 2-year intergovernmental agreement with the Health Choice of Michigan to provide administrative and management support to fulfill Health Choice of Michigan's duties as a municipal health facilities corporation.
All righty. Yes, sir. Name and title for the record.
Chris Johnson.
Yeah, you're not.
Good afternoon, Chris Johnson, Executive Director of Health Choice of Michigan and also Division Director for the Access to Care Division. What you have before you is a biannual intergovernmental agreement between Health Choice of Michigan and Wayne County. It's where Health Choice of Michigan reimburses Wayne County for the use of staff, office space. Actually, whatever hits the financial books of the Access to Care Division, Health Choice reimburses the county for it. And so this 2-year agreement totals $1,652,612, which gets split between the year at $826,306
For each year.
per each year.
Health Choice was a creation of the county of Wayne.
Correct.
If you just want to briefly say what that is.
Sure. It was created over 30 years ago by the county to help low income and the indigent with any kind of healthcare services that are needed. And so our big project that we operate out of there is our Health Choice Small Business Program, which we provide health coverage to small business owners, employees, and their staff. Currently have about 6,500 members on the program, about 1,500 small businesses.
Okay. And the board is created in the legislation that created the health authority. And it specifically names who was on that board.
Correct.
So Dr. El Sayed is a member of that board. I'm the treasurer of the board. The chair of the commission is on that board, as well as the chair of Health and Human Services. So that's what the board is. Any questions on this item? No. Has this crept up a little bit?
It has, but what we base it on is pretty much the budget that hits Access to Care, their budget. So that has increased over the years.
Okay. All right. Those are my questions. No commissioner, no questions. Okay. Not Monique Baker McCormick.
Next item.
Next. Yep. Madam
Item
Clerk.
2, requesting commission approval of an intergovernmental agreement with Wayne County Conservation District for polyfluoroalkyl substances research and educational services.
Okay. Name and title for the record, please. Welcome.
Hi, welcome. Avni Sheth, Medical Director of Public Health Department and Director of the Clinical Care Services Division. We have here a intergovernmental agreement, IGA, between Wayne County and the Wayne County Conservation District for this fiscal year for $50,000. This will continue to support their ongoing work to increase awareness around PFAS. And their work with the state to investigate sites in Wayne County. We have Connie Boris here, who representing from the Conservation District as well. If there's any input that you'd like from her as well.
Yeah. Ms. Boris, if you could join us here, please. And this is a IGA, it's an intergovernmental agreement. So that supposes, Ms. Boris, that the Wayne County Conservation District is a governmental entity.
Yes, that's right.
How is that?
We were established by the voters of Wayne County in 1969. We're going on 55 years protecting the environment and protecting the general health and welfare of the residents of Wayne County.
Okay, and what are you doing with PFAS then? What's your on the ground?
We represent Wayne County on the governor's Michigan PFAS Action Network. Our biggest thing that we have done is work with the environmental justice communities, particularly Southwest Detroit. I grew up in Southwest Detroit. My heart is there. They have one of the worst, air quality, environmental quality situations. So we work with them by doing talks, demonstrating what they need to avoid in the way of PFAS, like Teflon coated baking pans and other things that you have in your house. It's all over. And we want to make them aware, don't use that stuff because it will affect your child. What's really interesting in our research is we found that the PFAS concentrations in babies are higher than in their mamas. That was a real shock. So anyway, they got to really avoid it. Okay.
Commissioner Baydoun, any questions? No. Okay, anything else you'd like to say about this?
I really appreciate the commission's support of doing PFAS research, and I especially appreciate both Dr. El Sayed and Dr. Havani Shathan. We wouldn't be where we are without Commissioner Tim Killeen. He's been a very staunch supporter of the Conservation District for years. We appreciate that. And we thank you for your support too.
And the voters of Wayne County could create you because the Department of Agriculture nationally opened the door to conservation districts in almost every county in the country.
Yeah.
And in Wayne County, we said, sure, we want one. We'll put it on the ballot and see if the voters want one too. So you're in how many of the 83 counties in Michigan are there conservation?
Actually, it's now 75.
Yeah.
75 counties.
Yeah.
Some of them have merged together, but we bring in about 250,000 to urban farmers within Wayne County just by our existence.
Okay. Well, thank you.
Okay, thank you.
And we will move the agenda, Madam Clerk.
Item 3, requesting commission approval of Amendment 1 to a 3-year agreement with 2 one-year options to renew with Health Emergency Medical Services, Inc. to continue call center services for women, infants, and children program that is managed by the Public Health Division.
Now, I believe we have a couple of wicks wasn't there a couple of wicks on the addenda? No? We have the youth programs. This is the only WIC on the agenda? Okay,
Good afternoon.
name and title.
Good
Welcome.
Welcome. Thank you. Good afternoon, Natalie Dean Wood, Division Director for Public Health. I'm here to get permission from the commission to approve an additional extension to the HIMSS call center activity for the WIC program. This is a 3-year contract with 2 potential extensions, and we're reaching out for extension number 1.
And the call center means what?
The call center is where individuals call in needing WIC assistance. They take the calls and then they triage the calls on where they need to go within WIC.
Okay, so this is just for the call center.
Yep, just for the call center.
How many WIC locations does the county have?
Currently, we have 9.
9. So this call center refers to those 9.
It refers to only the ones that are operated by Wayne County, not the ones that were accessed in ACC. So, yeah.
Okay. The county,
So there would be 11 in total.
11 in
9,
total.
Yeah.
okay. And those are not what's before us today. This is
Correct.
just the call center.
Yeah, just the call center.
All right. Any questions? No questions. Okay. Well, thank you.
Thank you.
Thank you very much. Madam Clerk, next up.
We do have another WIC item, item 13.
Yeah, we'll handle that. Okay. But that's one of the locations, right? Yeah, the Garden City. Do you want to join us? See, I thought we had another WIC on there that was buried. This is an actual location
Correct.
that the county has. So why don't you tell us
Yes.
about Garden City, Wayne and Garden City?
So the WIC program rents space from the Garden City School District to hold a WIC clinic within their school system.
So,
And this is the
Yeah.
lease agreement.
so this is not, again, not the funding for WIC directly,
Correct,
but a couple of smaller contracts that help us keep the whole system going.
correct, for operations.
Okay. Okay, anything? Thank you. Madam Clerk. Next item.
Item 4, requesting commission approval of Amendment 4 to a 5-year sole source contract with the 1-year option to renew with Global Vision Technologies to provide continued maintenance support and hosting of criminal justice case management software and to implement a new FAM care system configured and customized for the Veteran Services Division, workflow data collection and reporting.
Good afternoon. Name and title for the record.
Good afternoon, Melissa Fernandez, Director of Juvenile and Youth Services. This is our request to exercise our last year renewal for our GVT contract which provides, maintenance for our juvenile database, our community corrections database, and we actually are adding a component for the Veterans Department as well. Adding the veterans will increase the value of the contract.
And this contract with Global Visions, did we have anything before we brought these folks in as far as a database and managing such a thing?
I believe it's been global from the beginning. I'll bring up
Yeah.
Mr. Sam to speak more about that.
Yeah, how long have we been working with this
4 years.
company for this database?
Good afternoon, Sam Haddad, IT Administrator. We always had Global Vision Technology. We used to use paper and Excel sheet to do all this.
Mhm.
So we brought them on board through a grant through the federal government back in 2001,
Okay,
and they've been with us ever since.
okay. And you like the work they give us, so you're
We do.
looking to
Yes.
We do.
do amendment 4 to the contract. Okay. Good. Anything from? Okay. All righty. I assume you don't go anywhere here for a minute,
Here.
but Madam Clerk, what's up next? We go to the addenda.
Moving to the addenda, item 5. Requesting commission approval of Amendment 1 to a professional services contract with the 1-year option to renew with DMC Consultants to continue providing services for lead abatement for the Wayne County Medical Lead Safe Home Program.
Health Officer, yeah. Welcome back. Okay.
Swapping.
Maybe I don't get the titles exactly right, but
That's okay. Chief
know.
Medical Officer and Division Director of Clinical Services Division. This is a renewal of our contract with DMC Consultants to do lead remediation and abatement services for our homes through our Wayne County Medicaid Lead Safe Home Program. And so this contract came before you this past fiscal year, and this is a 1-year option to renew to continue their work into the next fiscal year under this grant program.
and we're paying for this by a grant from the state of Michigan.
Correct.
Okay. 600,000 is not a lot. Do we have any kind of map of the county? Because what's the magical cutoff year? 72 or something for lead paint going into homes?
So the way that this program specifically focuses on some of our highest risk homes. So these are in Highland Park and Hamtramck. And if there is a home that is identified with unsafe lead in the home and meets a certain criteria under the program, we can see if they are eligible to receive services through our abatement program. And so, the funding is through Medicaid. So one of the criteria is that somebody in the household has to be a Medicaid beneficiary, a house built before 1978, and have a child under the age.
78,
Yeah,
there's the-
yeah. Okay, I'm sorry, I didn't.
Because that's when lead paint was banned.
Exactly.
So
So
any home in the county built before 78,
has a potential risk.
yeah.
Yeah.
Well, there's no small risk or little risk with lead, but anyway. Do we have that mapped out? Do we know where all the homes are that are built prior to 78? Because I know we focused on these two areas, but there's a heck of a lot more homes out there. Huh?
There's a lot.
Yeah.
of other cities.
Yeah. Yeah, do we have that mapped out at all? So we know,
We don't have that mapped out currently. We do, monitor the lead levels that we're getting back in terms of lab results from kids. And we have a general kind of map of where we see higher elevated blood lead levels.
yeah,
The households we have not mapped in terms of, those that are, built before that time period. But, there's a general kind of understanding of where many of these homes
Mhm.
or communities where there's a higher percentage of these homes.
yeah. Are they testing for lead at, in hospitals now, maternity wards when they? I know they're collecting
Mhm.
blood samples. Is lead part of that?
So typically, they begin screening for lead during the well child visits when the infant and the toddler follow up for visits. And so that is the current recommendation, because we worry most about the kids when they get exposed 6 and younger, right? And so that is part of the routine checkups in most like primary care, pediatrics, family medicine offices. And so that's where most of the lead testing is happening, in those kind of outpatient primary care homes. And then we also do some lead testing in the community sites through our WIC program. We try to integrate there, trying to get all the kids screened, especially during that period.
Do we have access to all of the lead testing that goes on wellness care? Is that all reported to the state and we know
Yeah.
who's testing for lead?
Yeah, so we receive all the elevated blood lead levels.
Okay,
So the cutoff has decreased over time because, to your point, no lead level is safe.
Yeah.
So the threshold is really low, 3.5. And so we receive that information on every child in Outwayne County, and we follow up and do case management, do a risk assessment, figure out what the source is and help the family mitigate those sources.
Commissioner Baydun.
Thank you, Mr. Chair. So currently this program is only for Highland Park and Hamtramck. Like, for example, I would think the city of Inkster, city of Dearborn, they have older homes. In Dearborn, for example, have many homes that were built in the 1920s, 1930s. And I'm sure they have lead in them. What needs to be done to include other communities in this program?
Yeah, so I think you bring up a good point, and this is really just the surface, right, of the problem that we get to kind of mitigate through this small grant program. There are some other programs that are administered through the state that provide some wider resources, and there's other opportunities through the HUD programs and whatnot. Currently, this is our main through Wayne County, our main grant program as of the moment that is focused on that Highland Park Hamtramck community. But we are always interested in understanding other resources that we can bring to Wayne County in this space.
Yeah.
But it's
There is a, there is a
lack there.
there is, a number and a program that the state, that residents in other parts of our jurisdiction can reach out to find out if they qualify for anything else.
I mean, part of the requirements being on Medicaid, right? Medicaid Lead Safe Home program. I mean, there's many of these homes in Dearborn. I can think of the different areas, like the south end of Dearborn. They're already suffering with the environmental injustice that goes on every day.
That's why they have lead.
I mean, it's yeah.
And Commissioner, that's why I asked if we had mapped out where all of these kids are testing. There's just not enough money in this
There's
grant
not
from the
enough
state
money.
to get to everybody. And again, I look at 600,000. How many homes have we been able to rehabilitate in the last year with this enormous 600,000?
Yeah, so what we're running into is that we are seeing really high cost homes that are the ones that need to be remediated
Yeah.
first in terms of the highest risk. And they're in a historic district. So that is also increases the cost of repair. And so we
Absolutely.
really are, just a
Not
few
to mention the
homes.
cost of home repairs, period, has gone
Exactly.
skyrocketed in the last couple of years. And I
Okay.
agree with you, Commissioner. Maybe we need to
We need to
talk to the
expand.
state
Yeah.
because it's also River Rouge,
Yeah.
Trenton,
E-course,
Melvindale,
E-course.
E-course. Yeah, Romulus, Westland,
Garden City.
right? A lot of that was built right after the big war. And that would all have lead base. I loved it when they made this stuff illegal. There used to be the lead paint company in Lansing. And when they made it illegal to have lead in the paint. Now it's Murphy's Paint Company. Oh, like somehow if we throw an Irish name out there, oh, that sounds really good. Yeah. Anything else on this one?
No.
But I do agree with you, Commissioner. We ought to rattle some folks in Lansing and say, do you have an idea of a total number of kids that have tested over certain values in the county?
We track that. We are really trying to increase testing too, because I think
Right.
we are under testing. And so we're kind of putting a big effort into doing outreach engagement and increasing provider awareness to start screening. But we do have numbers of those that are getting tested,
Yeah.
the number that are testing elevated, what
I'd like to
communities.
get that number.
Yeah.
Because what good is testing if we can't do anything about it, if we don't have any funding?
Right.
Yeah, your kid tested high at 6 months. It's got lead poisoning, but sorry, we don't have any resources to help you with that. That's not a. I know there's a few others out there, but it's all very minimal.
Right, and I can just give you an estimate from, 2022, we have about 330 children who've tested with elevated blood lead levels in Outwayne. But we know during the pandemic, the number of kids who got tested decreased too. And so kind of have to understand that number in that context. Before the pandemic, it was around 600, 700, 800 children that would test with elevated.
And then with
Levels.
our 600,000 in funding, and when I go looking down the list, 35,000 to Martin's Best Roofing in Hamtramck. Hell, you can barely roof one house for 35,000. I mean, there's not many. So do we know how many homes got done?
So
And
far,
then how
yeah.
many kids are involved? It's going to be nowhere near 600 kids.
No, yeah. And we really can only do a few homes with the amount of funding we have.
That's right. And I'd like to get those
Yeah.
numbers and how many had kids in them too, because I think, Commissioner, and that's what we say to the legislature, we got over 800 kids with elevated levels, and the funding you're giving us, we can abate it for 7 kids.
Let me understand this.
Yeah.
Roughly how many children were tested with elevated level of lead? About 300, you said in 2022?
2022, we have 329 that tested with elevated blood levels.
This is
Lead
throughout,
levels in Outwayne,
that's, an outer range.
yes.
Okay.
Not City of Detroit.
That excludes Detroit, so
Mhm.
That number seems to be low. I'll bet you there's a lot more than 329
That's
children.
what she just said.
Yeah.
Prior to COVID, when people were going to doctor's offices and stuff, what is the more historical number for how many kids? Going
Yeah,
back
so in
3, 4, 5,
2018, 2019, it was around 600 to
Yeah.
700.
So, and we're able to reach with this dollar, maybe 7 or 8 kids. So we need to let the legislature know.
Okay,
And the governor. Anything else on this one?
that's it.
Commissioner?
Thank you.
Thank you very
Thank
much.
you.
Well, who called my phone? Can somebody call her, see what's going on? And Madam Clerk, what's next on our agenda?
Item 6, requesting commission approval of Amendment 2 to a 3-year contract with 2 one-year options to renew with Southwest Counseling Solutions to continue to allow provisions of youth assistance programs and services to youth who are 17 years old and referred from the Wayne County Prosecutor's Office for diversion through the Right Track program.
Okay, and that's number 6 on our agenda, but also 7, 8, 9, 10, 11 are also youth assistance programs. Did another one Did another one, Madam Clerk, did another one get in here? I think.
No,
it's-
that was all. That was the last one, 11.
Yeah. So we have items 6 through 11, our youth assistance program. Name and title for the record. Welcome back.
Melissa Fernandez, Director of Juvenile and Youth Services. This is our contract amendment for our YAP program, our Youth Assistance Programs. We are requesting to exercise the 2 one-year renewal options. The YAP programs as our early intervention programs for at-risk youth through community referrals and school referrals. And they do service young people ages 7 up to 18 now with Raise the Age.
Okay. And these are not necessarily adjudicated youth.
That is correct.
This is to get youth that parents or school counselors or somebody have said, yeah, they're not in the juvenile system yet, but we're kind of concerned about them.
That is correct for youth, that there is a concern
Yep.
and for the prevention services as well.
And this isn't all of the youth assistant program locations that are before us, are they?
Correct. We have one more that did not make it.
Okay, that will probably come. And how long have we been doing this program, youth assistance?
I'm not exactly sure how long. I'd have to get that for you. unless
More or
I know,
less.
15 years, 20 years, 15 years. That's what I thought, 15 years.
Yeah, okay. Not too long after we took it over from the state
Correct.
on that. Can you give us a thumbnail on your estimation about the success of these programs?
Sure. Well, in fiscal year 2022, we served 661 youth. Out of those 661, only 2 were escalated for court services for programming. Of that 661, 265 were specifically for prevention services.
Mhm.
So they do a really great job. I can tell you, and I spoke a little bit about this at the hearings, the budget hearings. I get 5 to 10 calls a week from families looking for services. And we had that discussion as a department. And some of the feedback was we didn't know if we had the capacity to increase. And so that's one of our goals for the coming fiscal years. How do we increase our capacity? Because there certainly are more kids that need the services.
Yeah.
Also, with the juvenile justice reform efforts, the state will be increasing their portion of the payment from 50-50 to 75-25 for kids who are treated in home care.
We'd be the 25,
Correct.
the county.
Correct. We'd be the 25. So we will see an increase of young people being served in the community with enhanced supports for therapeutic services.
Do we solicit feedback from the families? How did this program work for you? Do you see any difference in the behavior of your offspring? Do we get that?
We
kind
do as part of the contract management data that we collect with the audits we do, and we can certainly provide that.
Can you characterize what you're hearing from families about this
Sure.
program?
The feedback from families, and again, I speak to a lot of families personally that call are grateful for the services. We get phone calls from folks outside of Wayne County looking for services that we would not provide services to.
Okay. Can we provide those services? No. From outside the county?
I don't, not under this, right?
Yeah.
We couldn't.
The YAP programs, yeah.
All right, so we're on item. Okay. All right,
We're gonna be voting.
all right. Did we discuss all of the?
Yes, we, 6 through 11 on the addenda,
Okay,
Madam
just wanna
Chair,
make sure.
are all youth assistant programs.
Okay.
Yep.
Great, next item.
Item 12, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services to accept funds from the local Community Stabilization Authority.
All right,
Good afternoon, Natalie Dean Wood, Division Director for Public Health. And we are just asking for these funds to be certified to be put into the bankroll for the Health and Human Services Public Health Division to offset costs of programming. This year, we are taking a different direction and looking at how we're going to strengthen the programs and services that we provide through the Public Health Department.
all right, any questions? Commissioner Colleen, Vice Chair.
Thank you, Madam Chair. Who the heck is the local Community Stabilization Authority?
Okay, I have a nice
We're
definition.
turning all government into authorities.
The Local Community Stabilization Authority was established in October 1st of 2014 as a metropolitan government for the metropolitan areas of the state of Michigan. Under the LCSA Act, the LCSA levies the local community stabilization share tax and distributes the revenue generated to local and intergovernmental units throughout Michigan, including the local health departments, to supplement funding for the essential local public health programs. And those programs would include food safety, hearing and vision, and communicable diseases.
So the state set this up to help local,
Yes,
and they're funded by the state?
through the legislator, yes.
Okay. Okay, and this is separate from, what do we call that thing, that $13 million?
The CPBC,
Yeah, the CPBC.
BC,
And it's separate from that kind of funding.
yes.
Okay, thank you, Madam Chair.
The funds would also, you said be used for hearing and vision
The hear-
testing
The hearing and vision program, correct?
programs. Is that including testing or?
Yes, it's the screening program that is, we have to do by law for
Okay,
the state.
okay. And is that through the FQHCs or?
That is actually through the public health department.
Okay. And so what does that programming look like? Do you go into schools?
We have a team of hearing and vision techs that go into the schools and actually do the screenings in the schools. They schedule the appointments once the schools are open. They usually do things, they work a 6-hour day and they try to hit as many schools in out Wayne County as possible.
Okay. And is that at a elementary level or all
We started
ages?
we actually started preschool.
Okay.
So with kindergarten roundup and preschool, elementary and early middle school.
All right, thank you. Next item. 13, 14, yep.
Item 14, requesting commission approval of a fiscal year 2024 local health department comprehensive grant agreement with the Michigan Department of Health and Human Services to receive and disperse state grant funds to carry out program activities for numerous local health department program services.
All right, do we have a description of what programs we will administer with this?
With the CPBC,
Yes. with
again,
these
this is Natalie Dean Wood,
Mm-hmm.
Director of Public Health. The CPBC programs are all of the programs that fall within the Public Health Department. Basically, it touches a little bit of everything. I do have a comprehensive list of those programs,
Okay.
if you would like to see it.
Package.
You got it, in the ba- yeah, so that's the list, yeah.
Okay, just want to make sure. All right, any questions on this item? Other questions? Nope,
Yeah,
All
Madam
right.
Chair, yeah.
sure. Oh, I'm sorry, Commissioner Kamoni.
Yeah, so this is the omnibus CPBC
Correct.
that we receive annually to deliver state responsibilities. They pay us to do state responsibility.
Correct.
Any idea? Vaccination of kids has fallen off the table. We're now approaching 65% of children in our schools that have been vaccinated. Something like that. It's incredibly low and going lower. Do you know that number, sir?
Yes, so Dr. Abdul Al Sayed, Director Health Officer, Department of Health, Human and Veteran Services. We've seen a major drop off in regular vaccine uptake in young people since the COVID-19 pandemic. The up-to-date numbers, we can furnish those for you if you'd like, but the drop off is something that we've seen consistent, frankly, around the country. Much of the question of vaccines is about public outreach. One of the goals of our fiscal year 2024 budget has been to increase our capacity to do the kind of outreach in the communities that both leverages folks' understanding of our availability and our capacity, but also does the kind of public health outreach that we need to make sure folks are understanding the importance of getting vaccinated.
And I'm sure you've had discussions with the state on funding on this, because as I look down the list, infant immunizations, that number did not change. Well, it went up very slightly in what we have before us here today. Lead poisoning prevention, that funding didn't change, although we had the other. There was actually a cut to the CSHCS vaccine initiative, which is what, our outreach efforts?
So it's a special program for special vaccines. So it's not really our outreach efforts. A lot of the state funding is for the operations of the vaccine unit, less so about outreach, right? And a lot of the requests that we've made in our 2024 broader budget, which was heard by Ways and Means and will be voted on by the full commission, is around some of the adjuvant services that we want to be able to provide that kind of broader outreach. One challenge, generally that we have around state funding, and this came up very recently with a CDC workforce grant, is that, even without the city of Detroit under our purview, we are the state's largest health department, responsible for about 10% of the entire state population. But a lot of the ways that funding is cut tends not to address both of the differences in size and then even more importantly, differences in need. And so this has been an ongoing conversation. Obviously we're grateful for the state support, but when you think about how those decisions get made, there is an equity responsibility that sometimes doesn't get met. And I think that's what you're really pointing to here.
Mm-hmm. Yeah, because no change in the amount for infant immunizations. And given the kind of immunization crisis that is out there and getting ever deeper, that the state is flatlining or in some cases cutting back a little bit on issues around immunization, that's of grave concern to me, old high school science teacher that I am. Yeah, not good. All right, I'll leave it go at that. But if you have the number, and it's been in the paper here lately, of what percent of school age kids, if we have it for the county, that would be great for our area. Just what we have, but I think a number that includes, I don't think Wayne County is much different than Roscommon County or Marquette County, or I think this is across. In fact, it might be a little higher up north, maybe. But whatever numbers you have, I think it's very enlightening for commissioners to see how few kids, and it's going down every year, are getting immunized. And more parents are signing those waivers. Thank you, Madam Chair, I guess.
You just talked about the outreach plan or the lack of this, I guess, thereof. Do you have one for the future, and what does that look like? Or are you going to?
One of the central strategic challenges we've had as a department has actually been fully expending all of the funds that come to us. And part of the challenge is a lot of the way we've operated in the past has been minimal passable unit rather than maximal possible service. One of the big requests that we've made in terms of administrative support in our future budget is about building the kind of adjuvant services across our department that increase our capacity to be able to provide that maximal possible service. And so building an outreach unit and leveraging things like community health workers in ways that get the message out a bit more effectively and efficiently than we have in the past is really critical to being able to squeeze out every last piece of value of those dollars. And so that's something that we're really focused on in 2024.
And so we'll have a plan of action coming soon. Is that what you're saying, basically?
Yeah, I mean, we've reorganized the department, as you know,
Right,
and
right.
part of that is to try and achieve some of the operational effectiveness and efficiency that we'd like, and to build the kind of capacity department wide to provide that. So less so necessarily in the form of a plan and more so in the form of infrastructure in our department that allows us to get out there pretty consistently. And so we'll be bringing a lot of those pieces to you as they require commission approval.
Okay, thank you. Commissioner Kleen.
Thank you, Madam Chair. Can we partner with other medical facilities to help us out of this? And I'm thinking maybe not for profit, clinics and that kind of stuff. But is it possible for us to partner with FQHCs since they are funded by the government to also collect some of these data as part of your overall plan for better outreach, that we can partner with them and they can be doing some of the outreach? Is that possible?
So we already have a number of relationships. Of course, we govern it or operate in FQHC or 2 FQHCs out of our department and out of this county. We are partnered with several FQHCs in the community.
Okay.
We are in the process right now, and this body has approved a community health needs assessment, which we are in the process of pursuing, which should give us really, really good localized information about some of the gaps that we have. The challenge with outreach isn't as much about not having institutions that provide service. If you permit me an analogy, it's like we have bricks, but we don't necessarily have cement. And a lot of what we're trying to do is build the kind of cement that makes sure that the bricks are connected. And that is a big goal of ours in the coming year, to be able to make sure that people have access to our institutions.
And I think whenever we have these discussions about outreach, and I think it's almost a truism that folks that need this stuff the most are the hardest to reach, either because of frequent moving, lack of cell phone service, don't show up at clinics to begin with so that they can be reached out to there. Is that pretty accurate?
That's entirely accurate.
Thank you, Madam Chair.
Thank you. All right, next item, please.
Item 15, requesting commission approval of the fiscal year 2024 project allocations for Emerging Threats Local Health Department grant agreement with the Michigan Department of Health and Human Services to provide continued support for the American Rescue Plan COVID immunization and epidemiology and laboratory capacity contract tracing, investigation, testing, coordination, and infection prevention projects.
All right, your name and title for the record.
Hi, everyone. Avni Sheth, Chief Medical Officer and Division Director of Clinical Services Division. This is our annual agreement with MDHHS and this is how they organized it last year. So I don't expect you all to remember, but they bundled all the COVID projects together under one agreement. They started doing that last year. And so this year, it's a continuation of our programs that started during the pandemic times to continue our response activities into the next fiscal year. Includes a program that provides emergency support and wraparound services for our high-risk families that we serve through our Healthy Families Home Visiting Program, our COVID immunization efforts, and some of our case investigation and epidemiology work around COVID-19.
All right. Any questions? EPI
Yeah.
tracing, what monitoring? Do
So
you know?
that it stands for our epidemiologists and our case investigators and contact tracing work that we do under
Okay.
COVID-19.
All right. And so how many do we have, I guess, for investigation and tracing? Is there like so many individuals that we have that move around the county and investigate?
Yeah, so we've our case investigation work has evolved since the beginning of the pandemic. It is, we still do case investigation on every case that comes through to collect surveillance information. And then our case investigation, our more kind of intensive case investigation work is focused on high-risk settings, schools, outbreaks, congregate settings, our correctional facilities, things like that, where we need to really control an outbreak or control a spread. And so we still have a team of, I would say about, 15 case investigators that respond to, we still get, all the positive cases still come through to us. So we do have to follow up and do some work to close those out. So they follow those. And then we have a, kind of a smaller team of epidemiologists and higher level case investigators that kind of follow these outbreaks that we respond to.
Okay, but it's not like it was in the beginning where you're trying to like piece together where it's all started
Yes.
and all of that.
Yeah.
Okay.
Yeah.
Okay, great. All right, any questions?
No question,
Yes.
Madam Chair, I will make a motion to move items 1 through 15 to full board for consideration.
It's been moved and supported. All those in favor? Aye.
Aye.
All right, motion passed. Next item.
Moving back to C on the agenda, approval of the August 22nd, 2023 meeting minutes.
Support.
It's been moved and supported. All those in favor?
Aye.
All right, motion passed. Next item.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item, please.
G, public comments.
Any public comments? Anyone in the audience? Anyone on Zoom? Or on the phone? Or emails?
No emails were received.
All right, next item, please.
Adjournment.
So moved. Support.
Meeting adjourned. Thank you. Thank you, Mr. Vice Chair.